Good afternoon and welcome to our hearing with the Department of Aging. We are glad to have Secretary Kovulich here and the staff from the Department of Aging. Before we begin, Chairman Struzzi, any introductory statements?
Yes, thank you, Chairman Harris. Very quickly, welcome, gentlemen. Thank you for being here this afternoon. So your budget proposal from the governor is roughly around $500 million, $3.2 million increase. And then with the Pharmaceutical Assistance Fund, that total comes to $501.7 million, or roughly a $3.3 million increase. I like to put those numbers out there so people who are listening who may not have this information understand the context of what we're talking about. So thank you.
Thank the gentleman. Mr. Secretary, before we begin, I'll just go, y'all stand, I'll swear you in. Do you solemnly swear that the testimony you're about to give is the truth, the whole truth, so help you God? Thank you. You can all have a seat. Mr. Secretary, if you wouldn't mind introducing the staff that you have introducing the staff that you have with you so that everyone knows to hear. Also, in the middle is our timekeeper. When the light is green, members will commence with 5 minutes of questions and answers. Yellow means that 30 seconds is left. Red means that their time has expired, and we would ask that you would wrap your comments up at red, unlike Representative Webster did earlier today. Representative Flood, you did well. You get a gold star. All right. Mr. Secretary, please proceed with introducing your staff with you today.
Good afternoon. I'm Jason Kovulich, Secretary of Aging for the Commonwealth of Pennsylvania, and with me is my Acting Deputy Secretary, Jonathan Bowman, and our Director of our PACE program, Mr. Tom Sneddon.
All right, let's get started. Representative Nelson, you're on.
Thank you, Mr. Chair. Thank you, Mr. Secretary, for being here today. Tom, great to see you. I'd like to start in a personal passion area of mine. We've done a lot of work over the years in the area of trying to address seniors and assistance for seniors in prescription programs, prescription assistance. We did MedSync a couple of sessions ago. You know, we've had PACE and PACENet increase, and last year, you know, we increased the moratorium so that 20,000 seniors could keep their benefits, which is, you know, that was a bipartisan celebration. But at the same time, last year, the AARP surveyed 40% of seniors 65 and older have skipped filling their prescriptions due to excess costs. You know, so in this budget, if we look at E7 and E8 in the governor's proposed budget, it decreases money to the Pharmaceutical Assistance Fund, which is that very program that helps seniors, by $20 million. Your projections anticipate a decrease, but can you touch on, because we have accelerating seniors, we have accelerating prescription costs, but we're taking $20 million from the prescription assistance program?
I can, and thank you for that question. And you know, that is based on trend analysis, and that is utilization within the PACE program. That's where that projection comes from. I could defer to Mr. Sneddon here. He can explain more in-depthly about the PACE program and why that variance occurs.
Yeah, well, you know, there's a lot of variables in the PACE program that drive the costs, like the enrollments, and then the claims volumes of the enrollment, and then the price of the product. And as you well know, the price of the product and the new products that are coming out cost a lot more money. So we have to be prepared to pay more. And if you look at the history, the 40-year history of the program, there's always been an excess of money over and above what we needed to cover our costs.
Sure, and I know we're limited on time, and that program has had an excess money, but at the same time, like just bringing it back to the district level, last session, I was attended a community hall at the Lincoln Heights Community Center, and we had a lot of seniors there, very frustrated with Pennsylvania because they did everything right. They worked, they saved, and now they struggle to cover their prescription costs, and we're taking $20 million from the prescription fund. At the same time, the governor's taking $325 million from the lottery fund to transfer to CHC. If we kept the lottery fund focused on those initial programs to benefit seniors, could we increase the number of seniors' earning levels that would be able to participate?
Well, of course, the more money you have, the more coverage you can provide. But in terms of the current income limits in the statute, and in terms of the current uptake in the eligibility pool, we have more than sufficient monies to cover the cost of people in the program.
Yes, totally agree. And I guess my frustration is, as aging secretary, I haven't seen where we're advocating to raise that amount and bring more seniors into a program that is funded by the lottery. I mean, we're taking almost a third of the lottery funds and sending them out of the program, and we're decreasing funding for prescriptions when seniors themselves would benefit. AARP says 40% of seniors 65 and older would, that they're struggling. Why not help more seniors? Why take the money to put into the slush of the budget to be redirected to programs that aren't helping seniors?
Well, I don't think it's fair to characterize programs across our sister agencies, and I'm not going to speak for my sister agency, that are designed to help older adults. And there's many programs that don't live at the Department of Aging that help older adults, whether it be from the Department of Human Services, the Department of Revenue, or the Department of Transportation. They all benefit from the lottery fund. So I think it's a balance, and I think there's always a conversation is how do we take the lottery fund and help it do more for older adults? The Department of Aging and the PACE program, we have always been willing to sit down and have a conversation to say, how will we do more? How will we do better for older Pennsylvanians? Also being good stewards of the resources that we have, also understanding that the lottery fund is what has kept all of these programs and these programs in the Department of Aging afloat, especially. So we're happy to have those conversations, sit down and talk about what that can look like. But again, I think it's fair to say that we know that the resources that we have in the lottery fund are benefiting older Pennsylvanians differently in every one of our departments, but they still are being used in that way.
Yeah, that's great. I think we agree. We'd like to help more. Thank you, Mr. Chair. I know my time is up.
Thank the gentleman. Representative Kozarowski.
Thank you, Chair. And it would be uncharacteristic of me not to shout out that our great Secretary here of Aging is from Scranton, Pennsylvania. So, okay, it's the third of the three secretaries that are from the Scranton area. So we're done. Representative Mullins and I get to be NEPA proud, but we'll behave next week because our ride is over. So welcome, and thank you very much for being here, Secretary from Scranton. And thank you for your team for being here as well. And I had the privilege of working along with you, Jason Kavulich, in Scranton as with the AAAs. So I've known you a long time, and I know that your background makes you the leader that you are here for the aging population. And I know the number is, are we the fourth or the fifth in the country with the largest, fifth in the population of aging adults. And a lot of these aging adults get to live in their homes, and that's the best place, I believe, for people to be able to live their years. But when they're in their homes, sometimes they do suffer from neglect, sometimes they are lonely, sometimes there's unfortunate reports of abuse. As they age, sometimes this generation is hard sometimes to reach, to get help. Sometimes they're a little bit more stoic. They don't want to go into long-term care centers. Sometimes they don't want to go to group homes, and that population is sometimes hard to reach. And I know that when the department does receive a report of elder abuse or neglect, I have three kind of parts here to this question. What process does your department follow to both investigate and ensure that these older adults are safe from harm? And when it does happen to an older adult and they are a subject of an investigation, during that process, and that adult unfortunately dies during that process, what is required to be reported, and will the case continue? And will the AAA engage, if necessary, law enforcement? So those three things, what is your department doing to, and I know you work with other agencies across the board to try to stop these horrible incidents from happening, but if you could just talk a little bit about when those things happen.
Thank you, and that's a really important question, and I want to get right to the heart of the matter, but we have to break this out into two different categories. The law, the regulations tell us, that we, through our area agencies on aging, to the 52 area agencies on aging that do the investigations when the calls come into their offices, we have obligations when an older adult dies during the course of a protective services investigation, and there is a nexus, a connection, some link between their death and the protective services case. The Department of Aging must make sure that the area agency on aging has notified us. It has to make sure that they have contacted the coroner's office and they've had to contact law enforcement. We take it a step further in my administration. Not only do we make sure that we've done those things, but we also have a process that we go back, now a formal process and procedure, that we go back, we work with other data that we have at the department, and we verify those sources. That is new, that is something we have done in this administration. We yet take it one step further, and we do work in the communities that you just described with the process improvement practice, much like they have in other systems, that looks at the work done on that community level, works with district attorney's office, coroner's offices, victim services, a local police, and sees that the process is good and that they can make changes to make the process better. So we have done that on the nexus side. Okay, that is the side that the law tells us to. On the side where the older adult passes away during an investigation and there is no nexus, no connection, we still do a check. We still check and make sure that those cases, there was no correlation. There was no instance where we needed to make sure that AAA needed to call law enforcement. And yet there is still yet another safeguard in that system. Outside of the social work system, and remember, when we have to close out our case because an older adult has died, we are social workers. We are not law enforcement, we're not medical professionals. We have the coroner's office that checks those older adults, and if there's any suspicion, they contact the district attorney's office. To date, no such instance has happened in my administration, or that I'm aware of, or that anyone has brought to us. So that is what we have as a process. And to just verify the numbers, since July 1st, 2024, until 11/29/2024, there's been 19,037 protective services cases. 482 of them, the older adult has died during the course of an investigation. 70 of those cases were nexus cases. We checked all 70 of those cases. There was no correlation in those cases. We also had 412 that were not nexus cases, and again, there is still no connection. There's still no reports. So we have taken our due diligence. We have taken to make sure great steps to make sure we have procedures, policies, and the right practice in place formally for the first time in an administration to correct this, or to address this. I'm sorry, excuse me.
Thank you. And I know the population you take care of is challenging, but I know that you work with other agencies, and I appreciate you being here and answering that question. Thank you.
Thank you.
Representative Brown.
Thank you, Chairman, and Secretary, thank you again for being with us. On page E85 of the Governor's executive budget, there's a $20 million initiative to provide operational resources for the AAA network to meet increased services and needs for the older population. It's my understanding that the AAAs receive a combination of federal and also state funding, which support the Options program, which provides home and community-based services. And then from there, the AAAs have to set their own budget based on their unique community needs. And then with that, there's potential waiting lists that occur. Is that correct?
That is correct.
Okay. So after the enactment of the current fiscal year's budget, we heard, and I heard very clearly from my local AAA, that they had concerns with the current funding level for pen care, as I'm sure you're aware, and the potential need for wait lists and service cuts. So how was that $20 million proposal reached?
That $20 million proposal was based on what we saw when the area agencies on aging, like I testified last year, when the ARPA funding ended for those area agencies on aging. So that is directly aligned. We lost about $18.5 million in ARPA resources that were being used for a period of time to prop up the work of the area agencies on aging. And we had said when that happened, we would see a backslide in services all across the 52 service areas. And that's what we've started to see chip away since July.
So moving forward, and I know, there were several town halls going on across the state as the governor wants to focus on this very vulnerable population. Have we projected the future needs of the AAAs?
Right now, our focus is to use the resources to stabilize, because right now we're seeing, so since I was here last year testifying to where I am right now with you, we've closed 30 senior centers. That means we have made sure that those senior centers means that older adults are not getting nutrition resources, older adults are not getting services that they need. That's just one example. We've lowered the hours in personal care. We've removed personal emergency response units. And like you said, these things happen differently in all the 52 service areas, but the impact is starting to be felt in every one of them. It just depends on how that administration is handling that impact.
So having said that, can you provide current data on the level of options waiting lists per service?
Yes, we have about, right now on the options, and that, let me just clarify about waiting lists. That's deceptive because waiting lists are talking about specific services in the options array, but there are other operational costs. There are protective services, there are senior centers, there are other activities that the area agencies on aging do outside of options that are all impacted by this.
Got it.
And we have about 2,707 individuals on the options waiting list right now, 55 individuals on the caregiver support program waiting list.
What was the category? I'm sorry.
A caregiver support program wait list, 55. The options wait list is 2,707 adults.
So on average, what is the wait time that a senior could expect?
It depends on what the wait list is for. Sometimes we're waiting for direct care workers because there's none to be had in a certain area. Sometimes it's funding. If it's funding, it's a much longer wait time. If it's a direct care worker, we're hopefully being able to make a connection. So I don't have the average. I can get that calculation to you. I just don't have that with me today.
That would be helpful. I'd appreciate it. And then it's my understanding that seniors pay for options services based on a sliding scale. That's correct?
Yes.
Do you have data on the number of seniors who are actually contributing towards their services?
Yes, we can pull that data out for you. We can provide that to you.
Okay, wonderful. I'd appreciate that. Thank you. That's all I have.
Thank the Gentlelady, Representative Mays.
Thank you, Chair. Good afternoon, Secretary. Welcome back. I love serving my seniors in the 24th Legislative District in the city of Pittsburgh. And my district office staff and I, we mainly serve seniors. We provide about 10,000 constituent services to one of my favorite set of constituents. And when they come to talk to us and they come to seek help, a lot of times they're asking for support around housing and how they can stay in their homes. I have a call on my voicemail right now from a senior who's needing her roof fixed. Many seniors want to continue living in their homes. However, often those homes require improvements or modifications so that seniors can remain safe. What do you see as the benefit of the governor's proposal to establish the Housing Stock Restoration Program, which would assist eligible seniors in making those improvements and modifications? I would love to hear your thoughts.
Thank you, and I really appreciate that question. You know, when we did our outreach to every one of the 67 counties and heard from over 20,000 older adults and their caregivers, housing was the #1 issue that we heard, loud and clear, in every form. But programs that we have in the Commonwealth that benefit people to do the roofs, to fix their porches, to do the repairs that you described, benefit older adults more than any other population. They help us keep older adults in their home. They help us keep older adults out of more expensive levels of care. They help us connect them to the resources in their community. So investing in these programs are investing in older adult services, whether it be the Department of Aging or another department. They help us make sure that our older adults get to live where they choose and are served how they choose.
And so a larger question I want to ask you. how important is a senior being able to stay in their home, continuing where they may have lived for decades or generations? How important is it to their health and well-being for the rest of their lives?
I think the broader statement is it is extremely important for us to let older adults live in the communities that they come from, whether it in affordable housing, the housing that they've always lived in, or some other way. But it's incredibly important to us as a state. It's incredibly important to us as a system to make sure they can live and make the choices of how they live and not be told this is where you have to go or this is where you have to move to. I think it's only fair to them that they get to choose just like you and I and have that dignity that they deserve.
Thank you for that. And I just want to share a bit of an update from our hearing last year. I was talking about dedicated housing for LGBTQ plus seniors, and there was housing being developed in my district, and I'm proud to say that the building is done, and the housing facility, the new units for these seniors, they'll start to accept applications at the end of the month. So I'm proud that that is an option for our seniors who are of LGBTQ plus lived experience, and I think that I will continue to uplift the importance of making sure that we are specifically looking at the unique needs of LGBTQ plus seniors, especially when it comes to housing. Thank you so much, Secretary, and thank you, Chair.
Thank you.
Thank the gentlelady, Representative Flood.
Thank you, Chairman. Welcome, Secretary and your team. My questions pertain to the Older Adult Protective Services. The governor's executive budget includes a $2 million appropriation to improve accountability and oversight of the AAA agencies. Specifically, how would this proposed funding accomplish this goal?
Thank you. And we're asking for an investment in our infrastructure, not just in personnel, but since 1999, we have been using the same computer platform, and it has been a patchwork of repairs and fixes that really is not delivering what we need. And that's a big part of what we're looking for, is an update so that we can provide better data, so that we can do better work. That system doesn't speak to our finance system. And our finance system is essential. One, we keep our 52 area agencies on aging accountable because of the finance system. And two, we're accountable to the Administration for Community Living for over $100 million. And if we're not able to report back accurately, we're in danger of losing those federal resources that help us do adult protective services and a myriad of other services within the department. So that money is an investment in the infrastructure, improving how we're able to gather, collect, and report data. It's also giving us additional staff because we have run very lean for a number of years, serving the fastest growing population in Pennsylvania. We're still operating on about 3% of our entire budget is to the administration of the department. So we think this is just a fair investment in helping us do better work and being more transparent.
So for several years, we've raised issues with non-compliance of AAAs, the lack of transparency in reporting which AAAs are out of compliance and the reasons for non-compliance. And while I appreciate your department pursuing the new monitoring process, the Comprehensive Aging Performance Evaluation, or CAPE, I'm concerned that this process doesn't adequately address the severe issues at hand. It is my understanding that under CAPE, AAAs would not be monitored annually, but every 18 months. And further, they would not face remedial action until they are deemed non-compliant for 3 reviews or at least 3 years. And respectfully, I think that that is unacceptable. That's about 4.5 years. You know, so how many seniors will continue to be hurt or maybe even die if they're waiting in that time frame for a AAA to be, you know, put under remediation? So last week, though, we saw in the news coverage of a tragedy in Philadelphia about a woman who needed services. Her case was gravely mishandled, and while I understand that you cannot comment on a specific case, how would this new system ensure that these types of situations do not occur again?
Thank you, and there's a lot to unpack there, so let's break it down piece by piece. Let's start with the monitoring system. The legacy system that I inherited was inherently broken. The monitoring that was done was inconsistent. There was no standardized sample of cases used at the AAA agencies. There was the questionnaire, and the tool that was used was flawed, the algorithm didn't work, and it was full of subjectivity. So we fixed all of those categories so that what we do now is rooted in law and regulation, and it can be brought right back to law and regulation and shown, which if you look at our website, you will see the sample of how it will be shown. Every one of the categories that we measure can be rooted in law and regulation instead of opinion where it was before. The first year that I came, the year before, they did 28 monitorings. 28 out of 52 were done the year before I came. My first year, we did 48. And then we changed the monitoring system and created a consistent rotation of seeing the AAAs. When we do the consistent rotation, it's built in to allow for the AAAs to develop their plan to correct their 12 months of issues. So we build in time for them to correct it, we build in time for them to implement it, and then we're back out there consistently. There had been no consistency in how we did anything until I became secretary. Now it's on the website. You can see when we'll be out to the AAAs. You can see the AAA's performance, and you can see the metrics that we use and how they're rooted in law. So we have.
I'm sorry, do you have any examples, though, of any remedial action that's been taken against these AAAs that are under the CAPE system? To the best of your knowledge, has there been any remedial or punitive action against any AAA?
So prior to my knowledge, there had been no remedial or punitive. Prior to my arrival, there was no remedial, there was no punitive action. In all the years that I just described with the 28 and the flood tool, there was no. But because we're on the point in time where we can address our cooperative agreements with the area agencies on aging, there is an enhanced system for the first time that's documented in policy and procedure how it will be handled. And no, the first pass on making sure we hold the AAAs doesn't come 4 years later. It comes after the first monitoring process. And then it comes, because we're checking every month, mind you, on their performance. And then it comes when we engage with their leadership in their community and start to engage county commissioners or board leadership on the change that has to be made. Where we sit today, until those cooperative agreements are in place and improved, the only thing that I can do is to take funding away from an area agency on aging. And that punishment means that I'm taking my funding away from services for seniors. So when we punish a AAA and take the dollars away from them because they're not performing, what we're doing is closing a senior center or stopping meals. So what we're doing now is working with the area agencies on aging, and if you look at the data, they are improving. If you look at 7 counties that went from having percentiles in the 50s and in the 30s to now in the 90s, we're improving them. We're working with them to make their work better, monthly, weekly, whatever it takes. So we're taking everything that you said seriously, but we're addressing it head on. And again, yes, I believe in accountability. That's why we're building standards of accountability, and that never existed before until we started doing the work when I became secretary.
Well, we definitely don't want to see funding being taken away, and we just want to make sure that we are doing the best for our seniors. So thank you very much.
I don't know. You may have dropped to a silver star now. I don't know. I'm going to charge that to him. I'm going to charge it to the secretary. All right. Representative Salisbury.
Good afternoon. I've been focusing a lot in these budget hearings on food access. So I know that a lot of seniors in my district and across the whole Commonwealth rely on services like Meals on Wheels. So I see in the budget that there's an increase proposed for these AAAs or area agencies on aging. If that increase does not happen, what happens to the capacity of the ability to provide services like Meals on Wheels?
Thank you. That's a great question. Well, we're already in a backslide. I will tell you that. We serve roughly 26,000 meals a day across our network to older adults. That's a combination of congregate and in-home meals. To date, we've served about 4,646,000 so far this year. As we close a senior center or a senior center's hours are reduced, an access point of congregate meals stops. So it's not just activities, it's not just bingo. People stop getting fed when we have to cut back on hours on senior centers. People go on wait lists when AAAs aren't funded to the point where they need to be if we don't have the resources. Since 2014, there has only been a 2.5% increase in the resources the area agencies on aging have to do this work. 30% of that 2.5% happened in the first year of this administration.
Can you talk a little bit about how that tracks with the increase in seniors in Pennsylvania? Because we know we do have an aging population.
So in the time between 2014 and now, that's a 22% increase in the population. And what we're seeing is older adults that we don't serve with our AAAs will be in danger of slipping into a more expensive level of care. So investing in this system is an investment in making sure people can live in their communities, have the supports that they need, have the services that they need, and can continue to live and thrive.
Can you talk a little bit about how people qualify for the Meals on Wheels program, who's eligible for that?
Everyone is eligible for Meals on Wheels in our meal programs. There is no cost share for food. Okay, so if you come and you need assistance, you will get assistance, and that's generally it. The Older Americans Act tells us how we have to administer our programs, and the Older Americans Act doesn't put a dollar amount on what a person can be served with. They say we must serve those in the greatest social and economic need. And that's broadly defined on purpose because the Older Americans Act exists for everyone over the age of 60, not just certain income groups.
So just to make sure and sum up, to make sure I understand, there's been a 22% increase in this senior population in the Commonwealth, but only a 3% increase in the funding available during that period of time to actually serve the population.
That's correct.
Sounds like we should maybe do a little better. Thank you very much. I appreciate your time.
Thank the gentlelady. Representative Krupa.
Thank you, Mr. Chair. So I thank you all for being here and testifying today. In my district, currently, funding levels are insufficient to support our AAAs. They're insufficient to assist older adults in need of basic services such as home-delivered meals, in-home personal care, and home support assistance, resulting in long waiting lists. Given the growing population of our older adults in our state and the increasing demand for services, it is imperative that specific steps are taken by the department to support the AAAs who are struggling to meet the demand for services in their area. One specific question that I have is with respect to the redistribution of unspent funds. It's my understanding that when there are remaining pen care funds in a fiscal year, AAAs are supposed to report that unspent funds, which can then be redistributed via an aging program directive. First, let me say I was really shocked to learn that this is actually an issue. In my area, the AAA is barely squeaking by. For the first time, they had wait lists for the Meals on Wheels, and the grab-and-go programs were eliminated. So have you noticed any patterns with this unspent money? Is it a funding formula issue? How is it that some agencies are barely scraping by and others have so much they can't spend?
Thank you, and I think it's a miscategorization of what is sent back. So our pen care dollars are most flexible dollars the area agencies on aging utilize. The dollars that are sent back are generally federal dollars. Those federal dollars come with strings in which we can use them. So based on need across the Commonwealth and the category of dollars that is sent back to us is how we have to distribute them. So pen care dollars, they're coming from an old area agency on aging director, you can use your pen care dollars quite liberally and quite effectively. It's your federal dollars that we struggle with sometimes because of the restrictions the Administration of Community Living has on how we use that. That comes back into the department, and those specific areas across the Commonwealth that could use those dollars in that category are who we prioritize where those dollars are redistributed to.
Okay, can you comment on, is there a pattern? Is it a particular area of the state that typically has these unspent funds?
There is no rhyme or reason. There's no consistent bad player, so to speak. It could be anywhere. One year, I can tell you, it was a county up north because they were doing a hiring freeze, okay? Another year, it was a county in the southeast because they could not get a provider in one of their programs. So it varies all across the state, and it really depends on the circumstances in that service area at any given time.
On average, how much money are we talking about in any given year, and is there anything we can do to expedite the process to redistribute it?
We distribute, well, I will get back to you with a number on average for the last 5 years of what we've had come back in. We'll look at that. That will get a little dicey and confusing because of the ARPA dollars blended in there, but we'll get back to you with that. But as far as expedite it, those dollars get out as quickly as possible. So we do them as soon as they get back to us and the reporting is done, we move them as quickly as we can.
With respect to some of the questions regarding the Cape, in response to questioning in last year's hearing, you provided information stating that there were 5,750 investigations or investigative cases that were open for more than 20 days. 3,503 were open for 60 days or more. Can you provide an update on these statistics? How would this new Cape system ensure that cases are not open past the required deadline? And are there sanctions for AAAs that regularly exceed the deadline?
And thank you. As a point of correction, the 20 days is not a required deadline. The 20 days is a regulation that has to be met only if the Area Agency on Aging has all the information necessary to determine the investigation. So right now, there are 5 AAAs that fall below the acceptable metric of determinations. 50% of the cases they are working, over 50% to be exact, are not able to be moved because we're waiting on information from medical providers and the medical community. Which then, if we corrected that issue, if we updated OPSA and corrected that issue, we would move those cases and all the Area Agencies on Aging would be in the acceptable category.
Okay. Moving on to a different point, you mentioned that you were currently reviewing new cooperative agreements with the AAAs, and you are now able to add punitive measures. Can you provide specific examples of the punitive measures you're including in these agreements?
Well, the most important punitive measure, the one that really has the most detrimental effect, is the de-designation of an Area Agency on Aging, which means if your AAA is not performing after we have met with their leadership, after we have engaged in their correction plan, we can de-designate them as an Area Agency on Aging, which means that we would then look into the community to find a new entity to be that Area Agency on Aging. That is not something that has ever been talked about. That is not something that has ever been done until I became secretary. So it is a serious issue because whenever we do something like that, we endanger services for older adults. So we need to be very careful in how we proceed. We need to be engaged with communities when those conversations are happening.
Thank you. I'm out of time. Thank you for your testimony.
Thank the gentlelady, Representative Abney.
Thank you, Chairman Harris. Thank you, Mr. Secretary and your team for being here. I wanted to continue the conversation at the intersection of seniors and housing and talk a little bit about the shared housing and resource exchange program, which I know is a current program we have that's in a limited amount of counties, including my home county in Allegheny. And so could you tell us a little bit more about what the shared program is and how it benefits seniors when they're looking for affordable housing?
Thank you. And SHARE is a great program, and SHARE highlights a great a great partnership that we have with the Department of Human Services. That money comes from the Department of Human Services, almost about $1.5 million for us to do SHARE all across the state. And what we do with that program is older adults or another adult, they come to live in each other's home. And we work with our people in the field to make sure that we build out agreements for how they were going to live, if there was going to be any reimbursement, how utilities would be covered, and we monitor that and support those individuals because living together is not always that easy. So it is a great program. It helps people that have a big home find people to live with them, cut down on their expenses. If you want to be, a little bit funny, you think about the Golden Girls, it really is just like that. It's something of sharing your home with another person and making sure that you use the resources effectively. It is a great program. It really is slow to expand, but it's also one that we may lose tomorrow morning, so because of how it's funded. So, I would hope that we continue to see the dollars flow. I would hope that we can continue to expand this program each and every year and make sure it's available everywhere in Pennsylvania.
Yeah, and to that point, I think right now it's in 14 counties, and we know that housing affordability for seniors is not an issue that's just germane to 14 counties across this Commonwealth. And so you talked about wanting to expand it. What do you think that would look like, and how are the different counties determined on where expansion would actually go? Is that a you-all situation determining, or is that a DHS situation?
That is it's actually neither. It's an Area Agency on Aging and really wanting to be able to and having the capacity to be able to expand that program. Sure. And want to do that program. We've seen great success, especially in rural counties. We're hoping to see it in more of a suburban setting. Our best successes have happened in rural communities all across the Commonwealth.
Cool. Thank you. That's all my questions. Thank you, Mr. Secretary. Thank you, Mr. Chairman. Appreciate it.
Thank the gentleman. Representative Eckert.
Thank you, Mr. Chairman, and thank you, Secretary, for being here. I appreciate the opportunity. I'm going to pick up on what my colleague, Representative Flood, was talking about, dealing with some of the incidences we have with some of the AAAs. So I'm going to turn, you're aware of it, we were talking about it, we tiptoeing around it. The Spotlight PA article, obviously, on February 24th, kind of highlighted some issues before your time, dealing with deaths during, and specifically the article was titled Deaths During Elder Adult Investigations Rose in PA's Largest City as State Regulators Took No Action. So first off, I just, going into this article, obviously, anytime that, deaths are happening in the aging population is really concerning, right? And as somebody that comes from a county on the opposite side in the children and youth area, we had issues with our local children and youth department where there were some unexpected deaths because of some agency issues there. DHS came really hard down on them. Came in, provided training. There was all kinds of stuff from the state level to really try to correct that problem, right? I know there's been some criticisms that you folks have not taking the appropriate action as far as dealing with these issues as it relates to this particular department. Obviously, one of our biggest AAAs in the state, if not, it is the biggest AAA in the state. I'm just curious, what is your department doing to correct that problem?
Thank you. And since I became secretary, we have a much more aggressive way of working with the area agencies on aging to improve their work. And you can see in the statistics that they are getting better. So there's monthly phone calls, there's been visits to such counties, because there are not just one county, there's multiple counties that need technical assistance. We've brought in enhanced training, we've brought in different levels of cooperation to improve the work. The focus is on improving the work, because as I said just before, the only punishment that we have, we're not DHS. So in a children and youth situation, you're talking about a licensing agent. We're not a licensing agent.
And understood. I was just using it as an example.
But I mean, there's a distinct difference between what they can do, because there's a 17-year veteran of children and youth, I understand that. What they can do and what we can do is really different. And that is why we're enhancing the cooperative agreements to build in more layers of accountability that didn't exist. Those cooperative agreements could have been changed in 2021, mind you, but they hadn't been. So now that we have the opportunity to do that, we're doing that. And addressing those systemic issues with the agencies in question and letting them know from the very beginning that this is different now, there's a different layer of accountability, and while we will not punish AAAs and take funding away from them because it's not hurting the agency, we're hurting older adults, there are other consequences, and unfortunately we might get to a point where we have to de-designate an area agency on aging, but that again has to be done carefully, so that we don't make sure that we jeopardize services to older adults. That's what we're there for, and any kind of gap in services, we're playing with people's lives.
And I agree with you. I don't want to take services away from older Pennsylvanians, but your agency has the ability to shift that funding to another organization within that community, correct? Am I right about that?
If there was a community resource available to do that, we can put it out for procurement. And we're also dealing with 52 agencies on aging. Some are nonprofit, some are county-based. So that also depends on the county's procurement system. It's not just on the department. Because it's a cooperative agreement, because it's designed differently, the county also has a say on how they do contracts in their own area.
So obviously in the city of Philadelphia, there's probably a lot of, I would think there's probably a lot of entities that could pick up this mantle. Have you guys had conversations about whether or not you need to shift away to another entity, or until they, can correct some of these issues that they've had, and this really goes across the state, obviously, but this is the one that obviously has been highlighted recently. Have you had those conversations about whether or not that's an appropriate step to take?
Well, to say this, in talking about broadly about underperforming area agencies on aging, there has been conversations, and there will be continued conversations with those that are struggling as the new cooperative agreements come out about talking about restructuring. Because many agencies, big or small, have not looked at how they've been structured for a number of years. So as we go forward and having meetings and discussing these new agreements as they roll out, those changes that you just highlighted, those conversations that you said, we now have the ability to have them with more authority than we did a year ago.
Mr. Secretary, do you have anybody, and I promise, Mr. Chairman, this is quick, do you have anybody within your agency that goes out and can educate or train these folks to if they're in a failing situation?
Yes, that's our entire technical assistance team. Okay.
Yeah, thank you. Thank you, Mr. Chairman.
Thank the gentleman, Representative Young.
Good afternoon, everybody. Good morning. I recently introduced legislation that increases the maximum income limit for the Pay SNAP program. Shameless plug, House Bill 654. Feel free to look it up and sign on, co-sponsor. It's a great piece of legislation across the aisle. Can you please tell me how many additional seniors will benefit or be eligible for the Pay SNAP program if the maximum income limit were to be increased?
Thank you. And again, I will defer to Mr. Tom Sneddon. He has those numbers.
Yes, we estimate that the eligibility pool in the program would grow by over 100,000. And we also estimate that approximately 30,000 new people would come into the benefit over the next 3 fiscal years.
Great. What do you anticipate the increased cost to be by providing coverage of medication to these additional seniors?
Well, starting in the first fiscal year, for 25-26, it would add about $14 million. In the second fiscal year, 26-27, it would add $19 million. And in the third fiscal year, it would add $23 million.
Just to be clear, you said 14 million with an M or a B?
With an M.
Okay, 14 million. Thank you. And can you provide your thoughts on how allowing these seniors the opportunity to receive financial assistance towards the purchase of their medication would benefit them?
Would it benefit them?
Right. Can you provide
Absolutely.
your thoughts on allowing these opportunities to the seniors, how it can benefit them?
Would benefit them by providing them with medications they can't currently afford to take care of their health and live independently in their own home.
I heard nothing. I'm sorry. Can you repeat what you just said? My apologies.
Yeah, it would benefit them by providing them with medications that would benefit their health and enable them to continue to live independently in their own home.
Awesome. Thank you so much. And thank you for highlighting the real reason why I think it's important for us to make sure that we're understanding each other in these hearings, because we are all either having senior members in our families or some of us are senior members ourselves. And so it's important for us to understand the better that we can take care of those who have once taken care of us, the better we can be in a Commonwealth. So thank you for your testimonies today.
Thank you.
Thank the gentlelady, Representative Alsumer.
Thank you, Mr. Chairman. Thank you, Mr. Secretary and your team. Appreciate your testimony here today. During the governor's budget address on February 4th, he stated that the budget secretary would conduct a comprehensive review of every program we offer in the Commonwealth to identify inefficiencies and costs that can be eliminated. The initiative, known as REMAP, is incorporated into the budget proposal by sunsetting programs that are duplicative and don't work. Understanding that your department was not part of the initial review, have you had any conversations with the governor and/or the budget secretary regarding your future involvement in the review?
Thank you. To date, I have only had brief conversations with the secretary about, potentially our organization being looked at the future. We are one of the smaller agencies in government, so I think, just size matters in this instance.
Understood. So have you conducted any internal reviews of the program that your department oversees to date?
Thank you. We are continuously looking for efficiencies, and our 10-year multi-sector plan, Aging Our Way PA, is designed to find efficiencies to make sure that we're utilizing all of the Commonwealth's resources effectively to serve older adults. As I said earlier, when you look at our entire budget, our cost, the cost of the Department of Aging is 3% of that whole entire budget. We run lean, we run efficiently, and programs that, you're right, programs do become outdated. We look at how we bring new life into them. And a key example of that is the Pennsylvania Link program that we've been talking about this year. Link needs a refresh. We get, almost $2 million, $1.9 million in federal funds to do the Aging Disabilities Resource Center work. If we make an investment in Link, it can be what older adults have asked us for, that navigation system. That efficiency, that improvement means that we don't have to build a new system for older adults. We can build off an old system and save us a whole lot of resources in that way.
Have you identified any other areas that are producing inefficient results?
Yes, absolutely.
Could you identify those?
Yes, our computer system. Our computer system is costly. Our computer system is costly to maintain. We need a refresh of that as well, and that is why we're asking for the resources to do that. I'll give you one very small example, and it is, in my world, small numbers matter more. We looked at how we moved our ombudsman system out of that computer system to a savings of $250,000 annually because we made those upgrades, because we got them into a better system. We have better data for the federal government, we have better data to work on, and we still have the savings. So we're constantly looking for efficiencies. We don't have the luxury, given we're serving the largest growing population of Pennsylvania, to not always try to find efficiencies to put resources into the hands. When you think about it, 97% of our resources go out into communities to serve older adults.
Okay, that's all I have. Thank you, Mr. Secretary. Mr. Chairman, thank you very much.
Thank the gentleman. Representative Fleming.
Thank you, Mr. Chairman. Welcome, Secretary. It's great to see you here. I want to talk about an issue first that's near and dear to my heart. The fact that many seniors rely on home and community-based services. And my father was one of those before he passed last year. He had home health care folks that came in twice a week. And honestly, with me doing this job, they were godsends for him to have him in there. Many of those programs are supported by the AAAs, but I understand there are vacancies and there are difficulties in the AAAs finding staff. How is the Department of Aging addressing those vacancies? What can we do as the General Assembly to help on that front so seniors actually have, the workforce that they need to help them?
Thank you. There's two parts to that question. One, we're still in a situation where many AAAs have difficulty getting an individual to come into an older adult's home to provide services because there's a provider wait list. There's about almost 1,100 right now as we sit here today. And then there's the situation that I spoke of earlier, the almost 3,000 individuals that are waiting because of funding. So they're two different areas. But what we're doing and what we're working on, and because the resources that we've been provided with, we are reinvigorating the Long-Term Care Council's Direct Care Worker Blueprint, working with members of the legislature who sit on that Long-Term Care Council to help us, continue to work with stakeholders, continue to work with provider agencies, find better ways to attract direct care workers. But we're also working on tools to support unpaid caregivers as well, making sure they have respite resources, making sure they have what they need because of the billions of dollars that Pennsylvania benefits from unpaid caregivers. They all work a second job while they're taking care of a loved one. So it's a multifaceted issue, and we can't solve it at the Department of Aging and with the 52. We have to do it in tandem with our partner agencies at DHS, all the members of the Long-Term Care Council, the stakeholders, and all of you if we're going to see some movement in this space.
Well, certainly if you have ideas on how, the General Assembly can help with that, I'm all ears and more than willing to be a partner in that effort. I want to switch now to, I remember back in October being with you at a House Democratic Policy Committee event up in Avoca where we addressed senior issues. And one of the big things that struck me was the lack of adult day programs and senior centers and what we can do there to ensure that they are more robust. And I believe Chair Madden said, it really comes down to a funding issue of, I think it was $12 million, which in the grand scheme of things doesn't seem like a ton to help our seniors. How can we better support, as the General Assembly, help your department better support the senior centers and make sure that seniors have things to do during the day?
Well, adult day centers are there are two levels of service. Let's start with adult day centers. They're generally medically based. They are an incredibly efficient and effective way to serve older adults in a community, and also make the best use of a direct care worker because there are less workers needed to take care of more older adults. They are incredibly cost efficient, but they are incredibly beneficial. They keep people in a lower level of care. We're not at full census with those adult days providers that we have all across Pennsylvania, because in many area agencies on aging, there's wait lists for services, and we can't necessarily get them in, or adult day centers don't have an incentive to build or open in those communities because the area agencies on aging don't have the resources to send the older adults to them, or for families and caregivers to get to them. As far as senior centers are concerned, I think everyone in this room agrees about the lifeline that senior centers provide to the older adults. It's not just a place for recreation. It is a place for information. It's a place for resources. It's a place where they go when they don't have connectivity because there's no Wi-Fi in their community. They get information, they get connected, they get a meal, and they get support. And again, we push back on what we've been pushing back on for 50 years, senior isolation.
Right. Well, thank you so much for the work that you're doing. I really do appreciate it, and thank you for being here today. Thank you, Mr. Chairman.
Thank the gentleman. Representative DeVanzo.
Thank you, Chairman Harris, and thank you guys for being here today. Mr. Secretary, I'd like to direct your attention to page E8-5 of the Governor's executive budget. In the current fiscal year, we have $2.95 million was enacted for Aging Our Way, PA. Can you please describe how you're utilizing these current funds?
Yes, we can. With Aging Our Way, PA, we have built our caregiver toolkit that we have been, we've been told to do. So our caregiver toolkit has been developed. It has taken states all around us 2 to 4 years to do that. In the time that we've had since we've received those resources, we have worked with stakeholders. We've engaged caregivers, care recipients. We've made sure we've had their input on design. We've tested it. We're about to market it so people are aware where it is and how to access it, and it will go live in June. So we've done that. We've worked with, we have worked to make sure that we have a tool to make sure older adults who have told us that they want this have an idea of that the person that's coming into their home to give them a bath when they see them at their most vulnerable moment, that person is safe, that person is checked, that person is not going to harm them or steal from them. We have a tool in place for that. We have resources for grandparents raising grandchildren, another important segment of caregivers. So we will have a legal helpline that reaches all across the state to help them with their legal questions. They don't necessarily get representation from there, but they can get their questions answered from a safe, trauma-trained, and evidence-based program. We are looking to reshape senior centers in the way we just talked about, making sure that they are access points for resources, making sure that center staff and the area agencies on aging are working together to connect caregivers to care resources, investments in the direct care worker blueprint that I just described in my last answer, building better age-friendly and dementia-friendly communities. Dementia-friendly programs are incredibly important, especially in rural communities, to those individuals that are seeing early onset dementia, or they have Alzheimer's or some other brain-related disorder.
All right, thank you. Thank you, Mr. Secretary. I have a question for you, another one here. Do you have any outcomes or data that supports the efficiency of the investment on how the things you just described makes the lives of our Commonwealth senior citizens better?
Well, we have not. We have just received the resources in September. The programs have just been built and put into place. We will have outcomes, but on our website you will see quarterly updates on what's going on in the program, and if you'd like to be on the mailing list for the quarterly update, we're happy to put you on that.
Yeah, perfect. The governor has proposed an additional $3 million for the fiscal year 25-26 for Aging Our Way, PA, to transform the infrastructure and coordination of services for Pennsylvania's older adults. Can you specify what this would entail and how it differs from the current year's initiatives?
Thank you, and I spoke about that in an earlier example. That's our Aging and Disability Resource Center, the $1.9 million federal dollar program that we do. It's an investment in giving that the improvements that are long overdue. This is what older adults in every constituency in Pennsylvania have told us they want. They want a system of navigators to help them navigate the older adult services world. This will help us build it on a system that already exists to train and support them with volunteers. We rely on over 11,000 volunteers across Pennsylvania to do our programs, but it will help us reinvent that infrastructure so we don't need to build a new one. That's what we're asking for those dollars to do.
Okay, in the governor's budget in the current fiscal year, the department proposes $11.7 million annually for the Aging Our Way PA. Your department projects expenditures of $5.9 million annually for this program through the fiscal year 29-30, according to page E8-6 of the governor's budget. Given this projection and the initial request for $11.7 million, is it realistic to say that you will not seek an increase in appropriations for the next 5 fiscal years?
In specifically Aging Our Way PA?
Yeah.
As we had said, we will continuously look to see if there's an opportunity for investment in a 10-year multi-sector plan that impacts the lives of every older Pennsylvanian. This is a dynamic plan that we intend to make sure we transform the service delivery system of Pennsylvania with. The governor's office has prepared that. Our department did not prepare that, so I defer specific questions to the governor's budget office on that document.
All right. Thank you, Mr. Secretary, for answering the questions today. All good, Mr. Chairman.
Thank the gentleman. Representative Friel.
Thank you, sir, and thank you, Secretary, for being here today. I have 2 questions I want to get to. One is the expansion. The rent rebate, property tax rent rebate program has been wildly successful. We've expanded it. What is the steps that the Department of Aging are doing to ensure that seniors know they can continue to apply for it as the index that increases each year goes up and the income goes up each year? How are we reaching those seniors to make sure that those who can and qualify get on that program?
Thank you. And, all of our work is really done with the 52 area agencies on aging. And I can tell you, as someone who was a director of an area agency on aging at one point, there's always calls when that comes in. So we connect them to where they can get their assistance in completing the application, just like we connect them with farmers market vouchers. So the area agencies on aging connect those individuals or help them get it or find a program that helps them do the property tax and rent rebate program. So services like we just described with the Pennsylvania Link are essential to navigate older adults to those services. Services at the area agencies on aging, which we call care management services, are essential to get those done. Having someone available to go to their home and help them do it if they're homebound is essential. That's what you get when you put a $20 million investment into this network. You get those individuals that will solve the problem, get the word out like you just described in any way necessary.
Well, thank you with that. In my area, one of the places seniors seek and have that help with those taxes are our area senior centers. And I noticed we're flat funded in a request of $3 million for our senior centers, but I also know a lot of that money is also through the AAA, where there's a significant decrease in funding here. How at risk are our senior centers, and is there an estimate of how many might close, and what are we doing to stop it, or what can we as the legislator do to help and stop these senior centers from closing?
Thank you. And that $3 billion is for the Senior Center Grant Program. So that provides a $2 million competitive grant for senior centers, plus a $1 million non-competitive grant for senior centers that choose not to enter that competitive pool. So it helps us keep a steady flow of resources to help them improve senior centers, whether it be infrastructure, whether it be investment in technology, et cetera. The dollars that will help us keep senior centers open are the Penn Care dollars. Those Penn Care dollars will help us keep senior centers open, will help us stabilize area agencies on aging, will help us keep this service network that you just described thriving and out there in communities where they need it.
Thank you, Mr. Chairman, for my time.
Thank the gentleman. Representative Mullins.
Terry, Representative Kozarowski stole my, Northeast PA fanfare, but the appreciation, which is sincere and lasting, for your service and your friendship to all of us and to every aging Pennsylvanian. So thank you. Wanted to just continue on. I know we mentioned and had spoken briefly about the property tax rent rebate program expansion. I'll tell you, as a legislator, that was one of the most one of the more momentous and important and memorable yes votes, pushing of these green yes buttons here on the House floor that perhaps I'll ever get to do. So it was just a special thing that was a long time coming for our Pennsylvania, or older Pennsylvanians. But can you provide your thoughts on how this has benefited seniors, but also what are your thoughts on ways we can help support seniors by expanding other programs like we did with the property tax rebate program?
Thank you, and I think the most important takeaway from that program is the COLA, the fact that older adults don't get pushed off the program if they get a raise in their Social Security or some other income that they have coming, because they have, they really don't see those resources changing all that much, but when they do, we don't want to see them lose a service for $20 or $5. So that's one of the greatest takeaways, applying that logic to other programs to make sure older adults still qualify in instances where Social Security increase a COLA to that might kick them off. I think that's a huge victory there. But also that we really can show the importance of the lottery fund, the importance of the way gaming funds have supported older Pennsylvanians, how that combination of that our predecessors created early on is one of the foundations of why we serve older adults better in our state than other states, that we work together to make sure that older adults are taken care of better in our state than any other state. 19% of our budget is federal dollars. That 19%, that $114 million is federal dollars. The rest of what we do is with lottery dollars, and we make a huge impact on older adults because of that.
That's interesting. And when you mention that proportion that is federal, how much, as far as what we are able to do with whatever's in our toolbox here, whatever's in our state legislative power, because I have a whole bunch more faith in this chamber perhaps right now than what may or may be able to be changed or expanded coming out of Congress. So I think just to know and have that continued dialogue with your department and the administration to know if there are those task list items that we should be looking toward. I know you wouldn't be shy.
I think all of us should make the effort to keep the lottery strong. The lottery has done well for older Pennsylvanians. The lottery continues to do well for older Pennsylvanians. Making sure that we keep our lottery strong is essential to them moving forward, especially in the largest point of growth that we're going to see in this population in our history.
Thanks so much, Mr. Secretary.
Thank the gentleman. Representative Kincaid.
Thank you, Mr. Chairman. Thank you, Secretary, for being here. I just want to say on behalf of my AAA and the folks that I work with there, they are very appreciative of the amazing job that you've been doing when it comes to accountability and transparency to make sure that there is more accountability and information available around older adult protective services. So I wanted to pass along their gratitude for that. I know you've talked about it in pieces in response to various questions, but I wanted to give you the opportunity if you have anything additional to add about the process that you have implemented in terms of improving monitoring and tracking of the key services.
Thank you, and I think the key takeaways of what we corrected and the flaws of the legacy system are, you know that there's a consistent sample size that is pulled in your area agencies on aging. It's based on metrics and science. You know that there's a consistent schedule when we will be monitoring the area agencies on aging. And there's a consistent time frame which they have to return their practice improvement plans, and we have to return it to them, and they have to implement changes. So there's consistencies and there's science behind it. We've removed subjectivity, we've removed opinion, we've removed algorithms that didn't work. And we built metrics rooted in law, rooted in regulation, that we know will remain constant and that we know can consistently be looked at across our service areas. But the biggest takeaway is we now have the ability to look at those areas that we need to do better as a department in training and supporting the area agencies on aging and making sure that they get their work improved. We have a clear roadmap of what trends exist just in an agency or what trends exist across an entire network of 52. So it helps us make the work better. It helps us change the narrative. It helps us do better work for older adults. And this process is continuous. We do this every month. We pull data every month. We work with agencies every month. This is not just a one and done, we'll see you in 18 months. We are doing this day in and day out. Our technical assistance teams are there, and our technical assistance teams are also working with the monitoring teams to make sure that our findings are accurate and that how we improve and implement our practice improvement plans are consistent. So you get consistency, you get science, and you get transparency, because everything, when we do the first release of data, you can see our schedule when we're releasing data on our website. When we do the first release of data from the January reviews to April, you'll see very clearly how each service area is performing, and not just in protective services. There's a whole wide world of services that aging does, that those results, that those monitorings will be available for you to look at too and see how they're performing. We don't talk about our Older Americans Act services and how we do in our area agencies on aging enough. That's a huge portion of their work. This will highlight all the work that's being done, and will show you what we're doing to make the work better each and every year.
Thank you. Sort of transitions well into my next question. So obviously I represent Allegheny County, and Allegheny County is the county with the highest older adult population per capita. However, Allegheny County actually lost money when the federal funding formula was recalculated to prioritize rural areas. And certainly I think it's important to make sure that we are taking care of our older adults in rural areas, but when you look at the costs related to homelessness and housing, other basic needs, nutrition costs are up 40%, and SNAP doesn't necessarily cover people. The cost of medical care, all of those things together are really putting a strain on the system. And so I'm wondering what it is that we as a legislative body can do to better support our AAAs and that have been impacted and that may be impacted by further cuts at the federal level.
Well, there's two things I want to take away from that. Is one, the interstate funding formula, though we did make a correction during my administration, it was not geared to benefit any specific population. There was just a change in something that hadn't been changed for a very long time. And we did a redo of the interstate funding formula in a far more transparent way, with a group of stakeholders, with representations from all 5 regions of the state for every area agency on, like for the area agencies on aging for those regions, with outside stakeholders, with CCAP, with the Senior Center Association, with the PA Council on Aging, and they made the decisions based on the metrics. The area agencies on aging involved had a blind metric that they could not see their data, but they made decisions based on that data as how that funding formula would be distributed. But the best thing all of you can do is to continue to advocate for that $20 million Penn Care increase. That is the resources that keeps area agencies on aging able to do all of the things that you described in your community.
Thank you. Thank you, Mr. Chairman.
Thank the gentlelady, Representative Khan.
Thank you, Mr. Chairman. Thank you, Secretary Koulouris, and thank you for your team. Thank you for your leadership, the Department of Aging. I want to have to say thanks. Last session, you came out to my district and we visited our older adult village network that we have. We have quite a few of the villages. We visited a senior center in our community. We visited a retirement home, and it was a full day, and appreciate the work. And actually, we started talking about that shared housing program and that Representative Abney was asking about. And I'm really proud that we worked on a bill with Representative Carroll that would codify that program in Pennsylvania so that communities that wanted to implement it would be able to. And so just want to thank you for that. Last session, Chair Madden of the Aging Committee led the effort, and I was honored to join her as a co-prime along with former aging chairs Samuelson and Kim on the Alzheimer's and other related dementias division under the Department of Aging. And as a nurse, someone who got my doctorate researching caregivers and older adults with Alzheimer's and other dementias, I know how much it's important. We have these are daughters, these are brothers, and then they have parents with Alzheimer's, with dementias, and these are unpaid caregivers. These are 400,000 in Pennsylvania alone, caregivers who are doing unpaid work to help their families. And so I was wondering if you could talk a little bit about this program that we passed. We got that passed and we appropriated about almost $2 million to it. Can you tell us how the progress is going with this new division under the Department of Aging, and also the task force center that was created to support that program?
Thank you, and we're extremely appreciative of everyone for the resources, the $1.9 million we have to establish the offices in the Department of Aging. We have moved forward quickly. We have a director in place. We have worked with the Alzheimer's Association and other stakeholders to build the job descriptions, looking at national models for individuals that will work in this office. They're posted, and we're interviewing for those positions. The selection committee of the committee has been done. People have made recommendations to us. They're sitting with the governor's office waiting for a decision. So we'll have all of those individuals in place, and we'll have our committee meeting very shortly that Secretary Bogan and I will co-chair. And we've been able to put the resources to work right away that we were given. We're working on projects like we've received, we funded breakfast data for the Alzheimer's Association through the Department of Health with their questionnaire to help them get information that they need. We have a partnership with the federally qualified health centers doing early detection work, educating physicians. We have a project to do community outreach and research that supports some of the DOH initiatives that need to be done, making sure people are aware of programs, aware of early detection, continuously having this conversation pushed to the front of the room. We're working to build, again, dementia-friendly communities all across Pennsylvania, supporting that network, especially in rural communities, because we've seen just on reports that have recently been released, this impacts rural communities in a very big way, and we have to do work in that space to make sure that we're supporting those. Again, supporting the toolkit, again, supporting the direct care worker blueprint, and these dementia-capable programs also, there's two different, they're dementia-friendly and dementia-capable. Those dementia-capable programs are also important and being implemented across Pennsylvania to work with those families, those caregivers, and anyone who's impacted in this world.
Thank you so much. Thank you, Chairman.
Thank the gentleman. Representative Siegel.
Thank you, Chairman, and thank you, Secretary, for being here today. As so many of my colleagues frequently do, like to shout out folks from their home area or their region. I would be remiss if I didn't mention J.R. Reed, who is not only board president of the Pennsylvania Association of Area Agencies on Aging, but also has been a consistent advocate back in my district for our AAAs. And so we appreciate all the work he does, and I'm sure he's been a consistent voice in your ear as well. As you well know, 40 senior centers around the Commonwealth have either closed or will close due to the insufficiency of funding from PennCare. This year, they've requested a $20 million increase on top of the fact that they were flat funded in our current fiscal year. You've talked a little bit about the value of AAAs in terms of keeping seniors out of the more expensive long-term care options like nursing homes, but also providing them with the dignity they deserve in their golden years. Can you talk a little bit about the impact that this $20 million increase will have on our AAAs, whether or not it will help us restore some of the services that have been lost, and most importantly, just some of the challenges you're hearing from our AAAs in terms of costs and burdens they're facing?
Thank you. And as I said, area agencies on aging have been making tough choices since 2014. With the fastest growing population, seeing their population grow by 22% in that time frame, they've been nipping away at services for older adults all along that time. This is the point of stabilization. The $20 million will help us stabilize, will stop the bleed, so to speak, to make sure that we can continue to keep senior centers open and that we can continue to take care of individuals on wait list, that we can continue to work with providers to make sure that we have direct care, that if we have adult day services, maybe we can seize this restoration, and this is because it's so dependent on the service area. I can't say this will definitely happen, but you might see the restoration of services like personal emergency response units. What the bottom line is, the cost of running an area agency on aging and the growing population has increased tremendously in this period of time. Without an investment in stabilization, they will continue to have to cut back on services, services that are provided to older adults.
Thank you, and so it seems to be that this $20 million is necessary to sort of hold the line, stem the bleeding, so to speak, but I think as some of my colleagues reiterated, and as you yourself stated, considerable increase in the number of Pennsylvanians over the age of 60, not the sort of commensurate increase in funding necessary to care for them. So is it fair to say that we're getting to that sort of crisis point where the system is, and its capacity is being vastly outstripped by the sheer needs and burdens placed on it?
Yes.
Thank you. And I know that my colleague, Chairwoman Madden, will address it a little more in depth about the full $105 million that Penn Care has asked for that I think is an absolute necessity. I want to talk to you about a broader point, and I know it's not directly related to your agency. It's more a question pertinent to the Department of Health and Human Services, but as we well know, there's a tremendous amount of federal doubt around the reliability of Medicaid. It seems to be the biggest part of the Federal Budget and Reconciliation Act, which they're looking to cut from. 2/3 of nursing home patients around the country rely on Medicaid to stay in their beds. Could you talk a little bit about the detrimental impact that would have on Pennsylvania families if Medicaid funding were to be called into question, potentially closing or shuttering nursing homes in the Commonwealth, and then those folks then obviously coming home to likely be the responsibility of their children to care for?
Thank you. I really would leave the Medicaid and Medicaid-related questions to the Department of Human Services. But I do have to say, we do also receive federal dollars, and changes in the federal funding that we get, the $100+ million that we get, could have a very detrimental effect on the programs we do. Remember, PA Medi, our Medicare Part B helpline, is federally funded entirely. If those programs go away, essential services to older adults, we will see more senior centers close. You'll see programs like that go away. You'll see health and wellness programs go away. And we've already seen the reduction in resources that we get from the federal government to do nutrition services all across the state. So the changes we watch every day, we watch for every day, because they don't only impact Medicaid, they impact our office as well through other funding streams.
So is it fair to say it would have a fairly devastating cascade effect, not only for seniors in terms of their ability to get critical prescription drugs and medication and nutritional services, but also for the families that then might be tasked with caring for folks that they have not been prepared to care for? There's the reason that many folks are in a nursing home. The families are financially indigent, right? They don't have the means to care for them. Some of these folks have dementia, which is why they're in long-term care facilities. So it's fair to say it would be fairly devastating from the perspective of families being responsible for the caring for these folks and then the seniors themselves.
Whatever resources Pennsylvania has coming in to take care of older adults, because we have such a large population, again, the fastest growing population in Pennsylvania, any loss of resources puts strain on all of our systems as a whole.
Thank you. I think it only elevates the importance that the state meet its needs and make its investment, elevates the importance, I think, of the $105 million request that Penn Care has stipulated that they need, and importance that we input our money where our mouth is, I think, when it comes to caring for the largest percentage of our population. So thank you.
Thank you.
Thank the gentleman. Chairwoman Madden.
Thank you, Chairman. Thank you, Secretary Kovulich, for being here today, and to your staff for your testimony and for your questions. I only have one question for you, but I'd like to start with a quick story. I have, for the better part of 2 years, been following on social media a woman by the name of Susan, as she chronicles her daily struggles to take care of her husband, Daniel, who is diagnosed with Lewy body dementia and Parkinson's disease. And from the beginning of when I started following her to a few months ago, that's how long it's taken her to get services. We in Monroe County don't handle long-term support services, so she's had to work with Monroe County and Luzerne County. And her posts in the beginning were heartbreaking, right? Talking about she's not well herself, lifting her husband daily to give him baths, changing him, guiding him every step of the way so he doesn't fall. And one post that particularly broke my heart was, I got up this morning, I fed my husband, I bathed him, I took care of all of his needs, and then I sat him down so I could run to the bathroom. And in that 5 minutes, he fell and hit his head, and now he's got a bruise. So a few months ago, she started getting services, and the post changed. They changed to, the new caregiver is great. He took Daniel for a pedicure today. He took him out. I got to be able to stay in my home by myself and relax and have a moment to myself. And then they get even better. We slept 6 hours last night because this new hospital bed is great, right? So we're beginning to see the quality of her life improve. Yesterday's post was, found these new great adult care diapers. They have, you know, they fit like a diaper, but they're really terrific. They're really absorbent, and we can sleep 6 hours during the night, right? Now, I found these great wipes too, but I'm paying for them out of pocket right now because I need a special waiver for that. He needs to be assessed before we can give them the funding for wipes, for adult day wipes. And through every one of these posts, she's saying, because this is what I have to do to take care of my husband with the dignity that he deserves, and hopefully on some level he understands what we're doing for him. So we know 6 years of flat funding our AAAs have put us in a really difficult predicament. We know that there is a 20% increase for Meals on Wheels. We know that elder abuse cases have gone up 67% in the last 5 years. And all of these numbers can be traced to starting from 6 years ago when we began flat funding our AAAs. Secretary Kovulich, I share your deep commitment to our AAAs and to our seniors. And to that end, I had a hearing on February 4th, and Rebecca May Cole from P4A said, we appreciate the $20 million, but what we really need is $105 million. And we're going to keep talking about the $105 million we need. So my question to you, Secretary Kovulich, is what is the number? What is the number that we catch up on our waiting list, that we give our AAAs the resources that they need to train a skilled workforce, and we pay that skilled workforce a livable wage, a wage that commensurates with the dignity and the hard work that they do each and every day? What's that number, Secretary Kovulich?
Thank you. And when you serve the fastest growing population in Pennsylvania, 3.4 million will be 3.8 million before you know it. 1 in 4 will be 1 in 3 before you know it. It's hard to put a number on that level of service, and that's why the department looks at what we can work with our area agencies on aging, how we can take the dollars that we can ask for and immediately put them to work, how we can make them help older adults each and every day as quickly as possible. So we believe in reasonable investment. We believe in a reasonable path to continue to find efficiencies and improvements in our systems to improve the infrastructure. Aging Our Way PA is designed that. It is not, even though 70% of that plan focuses on the work done by the area agencies on aging, the other 30% shows us that working with programs that already exist, that are already funded across the Commonwealth, like looking at whole home repairs as a program. That program is not designed for older adults, but yet it benefits older adults better than anyone else. So looking at all that we do, every time Secretary Siger fixes a sidewalk or puts up a new street light, it benefits an older adult. He makes cities safer for older adults. Every time Secretary Dunn, who testified before me today, every time she improves access to a state park, she helps an older adult.
Thank you, sir.
Thank the chairwoman, Chairman Struzzi.
Thank you, Chairman. I think we can all agree that, doing everything we can to help our senior and aging population is so vitally important. I know I hear a lot from the Indiana County Area Agency on Aging and, the need for additional funding just for the basic things that the senior centers need. And so I think we all appreciate that. But I want to talk a little bit about the abuse, I guess the claims and some of the systematic issues that have been highlighted today. And I do appreciate the work that you've been doing since you became secretary. But I think it concerns me to some extent that you don't want to de-designate, as I think that's the term, or decommission these homes where abuse might be occurring. But during the course of the investigation, these seniors are still in those situations, correct?
It depends. Every circumstance is different, so it's hard to say. There's no two investigations that are the same.
But if you get to a point, I think it would make more sense then to de-designate a location rather than have seniors stay in that situation, right?
I think we're talking about two different things. We're not talking about personal care homes or facilities. We're talking about a person's home.
Person's home.
We do investigations in facilities, but then the consequences to facilities is left with our sister agencies, not us. We help them identify if there's abuse or neglect, or we provide ombudsman services in those facilities. We don't have the authority to close a personal care home, a nursing home.
You don't?
No, we don't.
Okay. But you provide funding to them?
No, we don't.
You do not? Okay, so we're talking about funding then for people who are receiving care in their own homes?
we're talking about funding for people receiving in-home services, home and community-based services, so that they can stay in their home, senior centers, meals that we deliver. And the investigations that you're talking about, one of the key differences in our system, and that is tragically overlooked, is as long as an older adult has capacity, they have the right to say they don't want services. Some people don't like their answer. Some people say, but they're living in squalor. They're not living how we want to live.
Okay.
But if they have capacity and they demonstrate that they have decision-making abilities, they have the right to refuse services. We don't have the right to run into a guardianship situation because we don't like their answers. They have rights as Americans, they have rights as citizens of Pennsylvania, and our department has an obligation to uphold and protect those rights if they're saying they don't want services.
Okay, thank you for that. Just to clarify then, your sister agency would be the Department of Health or Human Services?
Both have dual roles in the
Both, okay. So then who has the oversight, I guess it's the area agency on aging, for the in-home care abuses that might occur? That's where the oversight comes in?
So for us, our cases primarily, well, I shouldn't say primarily, our cases could be abuse, both physical and sexual. They could be self-neglect. They can be financial exploitation cases. So there's just examples of our cases. So we go into a person's home, or, well, I shouldn't say we. First of all, that's my bad. One of the 52 area agencies on aging goes out and investigates. Okay, they respond in their timeframes, which you can see from our data. They have been doing an excellent job in doing. They investigate those cases. They get those investigations done by law when they have the information necessary, and then they make a plan. Those cases that are unsubstantiated, though, in that situation, are not unserved. That's a misnomer. Because a case is unsubstantiated doesn't mean the individual's unserved. That just means we didn't have enough information to substantiate it. And so older adults get services in every one of these instances more than likely because of the circumstances they're in. But at the end of the day, like I said earlier, we can offer them a care plan. They have the right to say no to it.
Right, but it should be the area agency on aging that is the one that is going to report the complaint, but they're the ones that are going and checking on these older adults, right? Yes. And you said you don't want to defund or take away funding from these AAAs, which I agree with. Obviously, their services are vital, but have you ever looked at sort of like pay for performance or like metrics that would maybe incentivize better care or better oversight rather than simply punishment?
I think that is a great conversation to be had, but that requires your assistance to do. We can't do that on a regulatory level.
Okay.
I think that is a conversation to be had. I really do see that there's a path there.
And I think that is a conversation we should have, because clearly these abuses continue and we simply cannot allow that to happen. So thank you for being here today and for your testimony. Thank you, Mr. Chairman.
Thank you. Mr. Secretary, thank you so much. The other day in Washington, D.C., the House passed a budget resolution cutting about $880 billion out of the budget. How much of the Department of Aging's budget comes from federal funds? And in addition to that, would you say that many seniors depend on federally funded programs like SNAP, Medicaid, and medical assistance? What would impact, like what we've seen start in Washington, D.C., what kind of impact would that have on us here in Pennsylvania with our AAAs and other services for our seniors?
So 19% of our funding comes from the federal government. Funding for programs that impact nutrition, protective services, and senior centers all alike come from federal resources. We would lose the ability to do the work at the level we're currently doing at, which we described today very clearly is still in need of investment. We would have a detrimental impact on aging services to lose, $114 million. It would have detrimental impact on older adults in every corner of Pennsylvania, rural or suburban. They would feel the impact. We would see a situation where we would be down to the bare bone regulation that there is one senior center in every service area, because that's what the Older Americans Act. So you think about big communities, okay, like Philadelphia and Allegheny and Pittsburgh, having that impact, that there's one senior center for those two areas. But then you think about rural communities that have a joinder, and like southwestern PA, where 3 counties are served by one AAA. That means one county gets one AAA and it serves all of them. So the detrimental impact of the loss of the federal funding is, I can't calculate it, but it would have severe impacts on our system, our way to serve older adults, how we serve older adults. We would have to probably look at a whole new way of distributing services to make sure we caught the neediest of the needy, and made sure we were providing services equitably across Pennsylvania.
Seeing that places like Philadelphia, Allegheny, or places like Philadelphia, Pittsburgh, have local tax bases that they could possibly find additional resources, would you say that places in rural Pennsylvania where the service area, maybe 3 or 4 counties, would you say that those places may be impacted even more severely than some of the urban areas?
I think every area of Pennsylvania will suffer. I don't think there's my small community versus a large community versus a rural community. We will suffer equally without those federal resources.
What does that look like? Go for on a day-to-day for a senior in Pennsylvania. What would those cuts look like?
You can be going from having 5 meals a week delivered to having 2 meals a week delivered. You can go to have no meals a week delivered. You can be able to get on a bus to go to a senior center, and that senior center no longer exists. You can look at some of the work that we do with PACE, and some of those dollars don't exist to support those programs. So like I said, I can't predict the full impact because we're still not clear of how far down it's going to go. But for example, tomorrow we can wake up in the PA Medi program that provides thousands of hours of support to individuals to get on Medicare Part B can be gone and shuttered completely. We have 7 other employees at the department that could be completely without a job because they're federally funded positions. So, I mean, that's just the never-ending ripple effect of losing resources from the federal government that support older adults in this state will have. And that pressure will be put on municipalities. That pressure will be put on the local counties. Someone from county government, I can tell you, county government in most instances has to catch all of this because we become the place where human services in all levels, whether it be drug and alcohol services, whether it be behavioral health services or children and youth and aging, we are the catch-all for all of these issues, and then our county systems will become overwhelmed as well.
So one of the things I wanted to hone in on is the food piece. You said some seniors can go from 5 days a week meals to 2 days to none. So if you look at a funding cut to the AAAs, but also funding cut to SNAP benefits, would you say that there would be some seniors in Pennsylvania that just would be left to their own to feed themselves?
Absolutely.
Wow. Where would they go to get support to feed themselves?
And you know, this is from human service experience, this is where people think systems are in silos. They're not. So you can't get your Meals on Wheels. You can't go to your senior center. You're going to the food pantry if you can make it. And then we have pressure on the food pantry system to serve a population that did not need to be served before. So those strains on all of those systems happen when you just impact older adults. And that's one of the key takeaways I've always tried to say. When you help an older adult, you help the whole community. You don't just help that one person, you help everyone because there's less strain on other resources that we have to serve other populations when you're serving older adults through our services.
So wrapping up on this, just kind of summarizing all that you said, you know, all of you have been in this field probably longer than I've been alive. Sorry. But to summarize, if the federal government was to move forward with the proposed cuts that we saw, it would have a draconian effect on the Department of Aging to the tune of around, you said your budget federally is 19%. And that would mean severe cuts to the AAA, severe cuts to meal programs, severe cuts to seniors all across Pennsylvania that some localities wouldn't be able to make up. Is that a fair assessment?
It's a fair statement, and it's a fair. Our system would have to dramatically change. You would not have 52 area agencies on aging if you lost 19% of our funding from the federal government. That wouldn't be a reality we can sustain.
So there's no way a person could care about these programs, but also be supportive or see that kind of cut at the federal level?
I don't believe so.
Thank you, Mr. Secretary. And with that, we will conclude today's budget hearing with the Department of Aging. I want to thank you so much for being here, but more importantly, thank you so much for the work that you all do. My mother, she's gonna kill me for this one, but my mother reminds me every time I talk to her that she is a senior and that she wants me as her state representative, not as her son, but as her state representative, to let her know each and every service, resource that is open to the seniors of Pennsylvania. Because I'm like, but Mom, you're not a senior. I am a senior. She reminds me I'm a senior. But when I put her age on Twitter or Instagram, then she gets mad at me for telling everybody how old she is. But she wants to remind, never mind. Y'all get my point. I love my mother. But again, thank you so much, and thank you for all the work that you do for seniors all across Pennsylvania.
I'll help you out a little bit there and tell you about my 71-year-old father who believes that I should be doing more for the elderly.
There it is. So we will conclude not only this budget hearing, but this week of budget hearings, and we'll be back here on Monday, March the 3rd at 10 a.m. We will have in front of us at that time the Department of Corrections and the Board of Probation and Parole. We will see you all back here on Monday, 10 a.m. Until then, these hearings are adjourned.